Welcome to Acute Conversations, the official podcast of APTA Acute Care, where we share engaging conversations about acute care physical therapy so you can connect to your profession. In today's episode, we have interviews and highlights after the APTA Acute Care business meeting and social event recorded during CSM 2026 in Anaheim, California. Enjoy the show. All right, everyone, I'm here, CSM 2026 over in Anaheim, California. I have with me the cardiovascular and pulmonary president, Ashley Parrish, who has done tremendous things also with our section, APTA Acute Care. But she's got some exciting news, if you don't already know. What exciting news do you have in terms of collaboration between the acute care section and cardiopulm?
Yeah, so we recently released our PEDS vital sign guide, and that was a collaboration between acute care, cardiopulm, and pediatrics. And it's a phenomenal document. It pairs well with the adult vital sign guide in acute care. So everybody pick it up, read it. Wonderful resource. And a great collaboration between multiple academies.
Yes, between the PEDS section, cardiopulm, acute care. And shout out to all the people that helped out. Don Drum, Morgan, Lupker, Rodolin, Brendan, thank you guys so much for all the hard work that you guys put in, because I think it's a fantastic document.
Thank you. I'm excited for it.
Awesome. Thanks, Ashley.
Thanks.
Madam President. All right, I'm here with the 2026 APTA Acute Care Lecture Award winner, Barb Smith. She had a fantastic lecture today, and one thing I really want to highlight is thank you so much for quoting some of the past award winners, right? And they were actually in the room. Jim Smith, Chris Permy, Jen Ryan. And so I think that was fantastic that you had talked about or had brought up some of the quotes they had. But one thing that I also thought was really important was your call to some of these researchers that are out there and what you have in store for the future of research within APTA Acute Care. Can you talk a little bit about that?
Okay, so there's a couple of things I think that, people need to bear in mind. Number one, we talked about, CSM's a great place where you can learn a lot and, you get a lot of information. But if researchers' goal is just to come to CSM and present, then we lose so much knowledge. And so really CSM should be a stopover. It shouldn't be the destination. And so we want people to come and share their work, but then they need to publish it, because if it's not searchable, then nobody can use it.
Absolutely.
So that knowledge needs to be carried forward.
You know what's fantastic too is I was just thinking about knowledge translation. The statistic that really kind of blows my mind is that, 17 years from
17 years
from when
average, yeah.
Right, and the average in terms of research for it to get implemented into actual practice, right? Which is crazy. Which again, your call is so that people that are involved in research, let's put better research out there. Let's get more people doing research, and then knowledge translation.
Yeah, and better research. I mean, it's an issue because acute care, right? It's very heterogeneous. It's a complex environment. There's a lot of factors that can influence, that are oftentimes out of our control, that can influence what happens to the patient. And so what that means is, on the outset of doing, whether it's quality improvement or it's a research study, nevertheless, you need to think, what is the question I really want to know, and what do I think will happen? And what am I basing that on? Make sure it's based on a solid foundation. Then you need to identify and try to estimate how many people you really need to answer your question. So sample size, estimation, generation, it sounds a little intimidating. That might be something that maybe we highlight in some future programming so that people can kind of better grasp some tools, even free tools that are available to them to do that. Because if we recruit, a really small pilot study and we get negative results, it might not mean that the intervention is ineffective. What it might mean is we just didn't include enough people. Right. And so, but that could stymie an entire program, right? An entire line of thought. And so some of these things that we need to think about at the outset, are there like special things about where I'm working that make my work less generalizable? are there ways that we can make it more generalizable? Maybe by casting a broader net, for example. So I think there are some things that our budding researchers, might want to think about on how to just control for some of those things that will make their work more impactful.
That's fantastic. What advice do you have for maybe some of those researchers out there that don't know that there are available resources through APTA Acute Care? What advice would you give them, and what resources would you kind of lead them towards?
Oh yeah, well, oh gosh, where do I begin? Because honestly, like we've got some fantastic resources for our members. This is an academy that is so invested in making members succeed at their passion, and so we have resources for selecting outcome measures, right?
Mm-hmm.
Our core outcome measure set.
Mm-hmm.
We have clinical practice guidelines. We have practice tools like lab value resource guides, ICU competencies.
Mm-hmm.
We've got podcasting,
right,
where you feature great science.
Podcasts, that's absolutely, with fantastic researchers.
Yep, and podcasts are wonderful because you feature a lot of great research and you deliver it in a way that's a lot more digestible for a clinician. Other avenues, journal clubs, so that people together can sort of pick apart an article and identify maybe some of the strengths and some of the foibles of that particular study, and maybe what they can learn and take away from it. And it's in a really kind of a safe place to kind of learn and chat about what other people have observed in reading the project. So, I mean, there's so many ways that that this academy is really working to try to uplift and elevate acute care clinical practice using the evidence.
Absolutely, and then communicating that evidence and knowledge and making sure that it gets used by the clinicians that are out there. So if you're hearing this, you're listening to this podcast, you're watching the podcast, contact us, let us know. Barb,
Absolutely.
thank you so much.
Yeah, thank you, Leo. All right, have a great CSM.
Thank you. I'm here with Carrie Lammers. Thank you so much for being here, and she's part of, I guess, the Barb Smith fan club. So can you explain 100%. The Barb Smith fan club, our lecture award winner?
So Barbara Smith is a professor at the University of Florida, and back in the class of, because I'm only 25, back then, Dr. Stephen George, Dr. Bishop, and Dr. Dorian Rose were all of my professors, along with Danny Martin, who is like a very now retired but infamous IMST researcher. So it was funny because we were sitting in the back corner as like the Barb Smith fan club, and I actually found out. So Stephen George, current editor-in-chief of PTJ, actually was like Barb's like student or something when they were at UPMC way back in the day. And then, just thinking about, my experience in Florida with all of these like very serious researchers, I had like a visceral reaction to when she was talking about,
Her
she was
slides?
going, so she was going through like the evolution of research in acute care.
Yes.
And one of her slides was from Danny Martin's research on IMST in a very early stage, and like patients improving from exercise. They were taking them off the vent, doing exercise, putting them on, measuring the, the diaphragmatic impact from that. And I had to answer a test question about that. And I was sitting next to Josh Johnson, who is also a current researcher.
Who's been on the podcast for his PT Pencil. Yeah.
He does a lot of things. And it was hilarious because I looked at Josh and I was like, so this is Stephen George, Bishop, Dorian Rose, Barb giving I was like, this is what it was like to be in PT school at Florida in approximately only 5 years ago, because I'm 25.
You had this visceral reaction to feeling this, right?
But I saw that image and I was like, oh my God, I remember cardiopulmonary. I remember vividly sitting in the class answering the question about inspiratory muscle training. But it's funny because like to this day, that was my group of professors. Yeah. They taught us to look at things very differently. Somebody asked me earlier about my own research, and I said, well, it's because I was taught to question everything from the start.
I want to just tell a quick story. I remember years ago, I think I met you, and I had heard that you were a black belt. You just kept talking about being a black belt. I'm like, whoa. But exactly, you're a black belt in what?
I am a lean Six Sigma black belt, which basically means I'm really good at working a very specific model of process improvement. So it's equal parts data, it's equal parts cultural evaluation and continuous improvement. But it basically means I've had high-level data analysis training, and it's actually from the mechanical industry, like building cars. Toyota is actually who created the founding principles. So when you think about how you making cars more efficient, you're thinking about optimizing cost, cost reduction of the processing of the actual vehicles, how you make skill align with where the skill is required. So you don't want to have really highly skilled people doing unskilled things. And also you just want to make sure that you're not over-processing or over-producing any of your resources, right? Because if you produce many cars, that doesn't help you.
And then one last thing, I think you were going to do a shout out to your husband and his black belt skills.
Oh my God, Karate Zach. Do not make me start.
Karate Zach. I heard a story about Karate Zach.
My husband gives a mean roundhouse kick.
You got to put your foot in the...
I don't want to... Don't put me on a national podcast doing Karate Zach.
I have with me two students from the fantastic University of Illinois at Chicago. We have Pia and we have Wilbert. Why are you interested in acute care?
Yeah, so I'm interested in acute care because I watched The Pit, and it's kind of silly, but I started watching it and I just realized that like people in the ER really do need like help. They're just very overwhelmed with a lot of different things going on.
So there's definitely physical therapists in the emergency department. Do you feel that in your future that might be something that you'd be interested in?
Well, yes. I absolutely think so. I'm trying to get a placement at an emergency room.
Trying to get placement. You should talk to your DCE.
Yes.
Hopefully he's cool.
Yeah, I think he's really cool. Yeah, I definitely want to try.
Hopefully he's connected through APTA Acute Care and he knows some people that work in the emergency department.
Oh, of course. I definitely think so. But I definitely want to try and see what it's like for sure. That is one of my interests.
Fantastic. And Wilbert, why are you interested in APTA Acute Care and acute care in general?
Yes, so prior to 6 months ago, I had it nowhere near on my radar. I always, thought outpatient ortho, sports kind of route. And it wasn't until I did those INA visits last semester in the fall that I kind of first got exposed to what it actually is. And I just thought it was really fun, seeing the patient from the hospital bed, getting them up and moving for the first time. I just like being in that environment, having not just PTs there, there's OTs, speech, there's the nurses.
There's a professional collaboration. I think you should give a shout out to your INA professor from the University of Illinois.
Yeah, Dr. Jones. I like the class. I don't know what much else to say, but I like the way it's structured.
Dr. Jones, thank you so much because we had a PT student that was originally thinking about outpatient orthopedics that might become an acute care convert. So Dr. Jones, thank you so much for all that you do. All right, I'm here at CSM with some colleagues from UIC that I have with me. I've got Matt and I've got Oliver, both who teach in UIC's PT department. And they came up to me right now, they said that there were some rumors about the Oxford debate. So I was part of APTA Acute Care's Oxford debate, but supposedly there's rumors about what happened during this Oxford. So I'm curious to know, what did you hear about our Oxford debate?
Yeah, I heard that you ripped the shirt off and that the buttons went into at least the 5th or 6th row. And then you kind of twirl it around your head is the gist of what I heard, yeah.
So that's who's telling you this? Was it students, other therapists?
Students, therapists?
Was it on Facebook, TikTok, staff? Oliver, what did you hear about this Oxford debate?
I had students come up to me saying it was electric and that the reason that they missed the first part of our talk was because they needed to see this electricity happen in person. Shirts were flying everywhere. Apparently balls were flying everywhere.
Balls and shirts flying everywhere? Okay.
Yeah. And you pretty much set the bar for any future UIC faculty talk at CSM.
So just know, for future CSMs, you should come to the Oxford debate because it gets pretty wild and gnarly. So thank you guys for keep spreading the word of what happens during our CSM debates.
Oh, yeah. Happy to do it.
Thank you guys. Here with Daniel Dale, who is the recipient of the Catherine Harris Educator Award. Congratulations.
Thank you very much.
Awesome. So how does it feel to be nominated and then also to get the award?
It's an incredible honor. I want to say thank you to those that nominated me and really put their faith in me. Jim Smith, Jeanette Anderson, Michelle Dennis, Barney Poole. Great group of colleagues who really put their faith in me, and just appreciate being recognized for such an amazing award. So.
Fantastic. When we had you on the podcast, you were talking about simulation. What's going on in the world of simulation and clinical education for our DPT students?
A ton is going on in simulation. As you know, we're continuing to think about acute care, having to provide all of those opportunities for students to practice in a safe environment before they go out, really making them more confident, really thinking about their readiness. And so one of the big things in simulation we're working on is trying to get more outcome measures that show the effectiveness of it. We know that students like it. We know that they feel comfortable doing it, but are we really moving the needle in terms of effectiveness? How are students doing in terms of clinical outcomes? So we're looking at that in terms of acute care, ICU, all of our critical care environments, and trying to figure that out.
Fantastic. And I also want to say congratulations because Daniel was on the team of the pro team for the Oxford debate, and his team won the Oxford debate. And so you had some fantastic teammates too. Shout out to Adele Mazinski, also Sharon Gorman, my teammates Aaron Thomas and Alisa Curry. So it was a fantastic debate. Make sure that you're there next year at CSM because we're probably going to be debating again.
It was an outstanding time. If you've never been to the Oxford, make sure you're there. Leo did a fantastic job on the losing effort, but it was very good.
And then also shout out to Katie Brito, who was part of that, and also Edward Mathis, who was our MC.
Absolutely. Always a fun time. Always a great time at CSM.
Awesome. Thank you, Daniel.
Thank you, Leo.
All right, I have with me PTA member at large, Abby Katamas. So I want to make sure that I introduce you. But the previous PTA at large was Carrie, and so now you were at the helm to represent PTAs and what PTAs can offer to the acute care section. Can you tell us a little bit about yourself?
So, like you said, my name's Abby. I've done acute care for 6 years. I've been a PTA for 6 years, so pretty much my whole career is acute care. It is what I like to say is my bread and butter. I did COVID ICU, was on a proning team, and now I do trauma ICU and oncology. Spinal cord injury patients are my favorite as of right now, but my big thing is I just really want to advocate and try to get more PTAs into the acute care setting, but also get them more involved so that way we can really have a seat at the table.
When we looked at the numbers during our meeting today, we saw the membership of PTs, PT students, and also PTAs, but I don't think we have enough representation, don't you think, in terms of PTAs in the acute care section?
No, I agree. We have a little over 200 PTAs in our section, but there's studies and census shows that there's more PTAs in the acute care setting, but we don't nearly have enough as far as membership is concerned. And there's just so much that the Acute Care Academy has to offer, especially for PTAs. Absolutely. And if it weren't for the Acute Care Academy actually as a whole, I probably would have left the therapy profession as a whole. This has really driven me to be like, yes, as a PTA, I am heard, I am valued, and you guys do a wonderful job too here at the Academy making sure of that.
Fantastic. Can I ask you, what got you interested in acute care?
Oh, I feel like it's kind of a loaded question. So I grew up around healthcare. My parents were corpsmen in the Navy. My mom, when she got out of the Navy, became a nurse. So for as long as I've been around, grew up going to work with my mom at surgery center. So I was around nurses and doctors and everything. So I was like, how do I get involved in healthcare without following in my mom's exact footsteps? Essentially, I wanted to follow side by side, not in them. And I was an engineer major first, actually. And my big dream was I wanted to rehab veterans and make prosthetics for them. So I ditched the engineering degree and went rehab only. And when it got to acute care, I have an EMT experience. So I have that critical care experience as well, and had one rotation at a hospital and fell in love with it. And that's kind of where the story got written.
That's fantastic. I think the first time we met, it was at APTA headquarters, right? It was like the leadership retreat meeting. And then also another person that helps us a lot with APTA Acute Care is Katie Maher. And I just remember the whole time you guys were talking about reality TV,
Reality
right?
TV and
so,
Disney.
so reality TV and Disney. So tell me, what are you watching currently in terms of reality TV?
Love Island.
We need to get Katie on the podcast too and ask her what is she. Let's ask Katie too and see if she's watching the same thing.
Yes, Love Island, and the next season of The Bachelor or Bachelorette comes up in a few weeks, so that will be my next binge watching.
That's awesome, Abby. Thank you so much for coming onto the podcast.
Thank you for having me.
Fantastic. Now here with Jim Smith, the great Jim Smith. Jim, what are you up to nowadays? And also, Alan Lee is in the background. Come in real quick. Come in.
The legend is here.
Look, I am in the presence of two lecture award winners.
Hey.
Right in front of me. You've got Alan and we've got Jim Smith.
Yeah.
Thank you so much for being here.
The old guard.
You're
You're the new guard. You're
yes.
All right, Jim. Great seeing you. Safe travels.
Take care. So, Jim, tell me, what are you doing right now in terms of APTA Acute Care? What are the different activities and boards that you're sitting on?
Now, I am here for the parties at CSM. For those of you who aren't getting to CSM this year, you've got to come next year in Philadelphia. My role with Acute Care is Clinical Practice Guidelines Chair, and then I just hang around and enjoy the great folks in the section.
You know, I think what's pretty cool is that Barb Smith was our lecture award winner, but she had cited a lot of previous award winners, and she had cited your parts of your lecture, right? Praxis of treatment or practice of...
The praxis of physical therapy.
Absolutely.
Yeah, that... I had one of the great highlights of my career 2 or 3 years ago. I was at CSM, and a physical therapist walked up to me and said, you're Jim Smith, right? And I said, yeah. And she said, I keep your lecture on my desk.
Wow.
And that has just hit me so deeply. It was great.
You know, you have had a profound impact on APTA Acute Care, its members, physical therapists. I just want to say thank you for all that you do, because this is what Mr. Jim Smith is, a bridge. And if he sees you, he'll say, do you know this person? Do you know that person? If you want to come and help out with APTA Acute Care, this is the person to talk to.
That's kind words. Thank you. So with that, tell me, what's your new role with APTA Acute Care?
So today I was installed as the practice management committee chair, and so we've got some good things coming up in the horizon that we're working on, and I think it's a fantastic opportunity for me to be able to serve.
So if you don't mind, I'm thinking now that you brought it up, practice chair. At one point, APTA was encouraging we have practice chairs, and so as president, I recruited a couple of people to be practice chair. That was James Tompkins and Tracy Norris, and they said, what do we do? I said, I don't know. You're going to build it. And they've built it, and we have all these amazing practice resources, and they've gone on to leadership roles, and I'm looking forward to you following in their footsteps.
I got some big shoulders to stand up on, but I've got some good mentors and good people over here at APTA Acute Care.
And you got great skills, so I'm looking forward to it.
Thank you, Jim. I appreciate it, sir.
Thank you.
Take care. I have with me Archana Vatwani, who is the education chair for APTA Acute Care. Tell me, what do we have to look forward to in 2026?
Well, we have Bridge the Gap conference this summer, and we're super excited about that. And then the education subcommittees, the webinar, the journal club, and the learning management systems are very hard at work. We're trying to get very diverse topics in different aspects of acute care, looking at even like bariatric surgery, PT that's focused on oncological care, pediatrics, so just literally looking at the different aspects of acute care and what complex patient care is in all spectrums of it.
So I would just like to say that originally Archa did not want to do this because to test her gait was a little bit, right? It was a little bit...
I'm exhausted. No, don't give false impressions. He always catches me at the last moment when everybody's left. I'm like, I'm too tired. But always a pleasure working with you and speaking with you.
Thank you so much, and thank you for all that you do in terms of the education. Because I've been seeing all the different webinars you report. You are working, and so there's so much that goes behind the scenes. Your networks, the people that you're finding, the people that you're inviting, and the people that are doing some of this education. You give so much depth and breadth to the education for APTA Acute Care. I'm so glad that we have you on our team.
Can I just give a shout out to all the team members that I work with, and even the different committees, practice committee, all the education committee members. It's 1 year since in my new role, and it's an honor and a privilege to work with everybody and bring out all the good work that hopefully is going to benefit all of our members, especially the acute care members as well.
Thank you for everything that you do. All right, I have with me Lauren. Lauren, what is your role in APTA Acute Care? She's a student, but what else do you do?
Yes, so my role is actually one of APTA Acute Care student leaders. So we meet once a month and we discuss strategic planning and then other sorts of events to work on community engagement and also student engagement, which we are trying to currently increase. And we have loads of events that we are trying to plan to engage the APTA community, APTA student community, and just like so many other events such as like residency panels. So a whole load of events. So yeah.
So let me ask you this: what got you interested into APTA Acute Care?
So I have the privilege of having a great support system at the University of Connecticut, where I'm doing my doctoral program for PT. Shout out Dr. Jim Smith and our program director, Dr. Mary Claire Capetta, just to name only two of many, but they are very passionate about APTA and getting involved as a student. So, one day I dove right in, found out about student leadership, and ever since I got the position, I've just learned about so many different resources and opportunities, professional networking, and it's made just my experience with wanting to become a PT so much better than I could ever imagine. And it's honestly like the best decision I've made so far in my career, early career as a physical therapist. So
that's fantastic. Yeah. So for those students that are out there that are kind of interested in acute care, what are some of the benefits for being an APTA Acute Care member? I think the first thing that comes to my mind is the cost. What is the cost associated with being an APTA Acute Care member as a student?
Yeah, so the cost is free. We don't hear that. We don't hear that as DPT students. Free? Like, you have to take advantage.
Come on.
And a part of just not just APTA Acute Care, but APTA in general, you get access to so many loads of research. And then within APTA Acute Care, we have different, like the lab values, as an example, that you have to create. Yes. The toolbox. There's just so many things that you can access as a student going on rotations that it's at the tip of your fingers.
And resources, right? So
yes. Yeah.
Resources that they have. They've got like tips for like chart reviews. What else do they have? The lab values.
Those are the two I can think of off the top of my head. I know if you go on APTA Acute Care website under the students and resource section, there's like a whole list of everything. Yeah.
So you have a friend, Abby, that's on the side here. Is she interested in acute care?
She's, she has a lot of different interests right now.
Abby, come over here. Come over here. Are you also from UConn?
Yes, I am also from UConn. I'm also a second year.
Fantastic. So do you have any favorite stories about your professor, Dr. Jim Smith?
Oh, Dr. Jim Smith. He's really inspiring to all of us as students at UConn. We really just enjoy his input and stuff, and he really loves acute care and just applying all of the evidence. He really likes evidence-based material, so just anything applying the science and the research to what we're actually doing in practice.
Fantastic. I also do want to. You can come in here, Lauren, too.
I have a funny story about.
Oh, do you have a favorite story about Dr. Jim Smith?
Yeah. So last year we had to do this thing called white lies, where you put a white T-shirt on, you write a little saying, so it's the opposite of what you're actually saying. So me, as an example, I could be like, I don't want to become a physical therapist. That's a white lie because I do want to become a physical therapist. So as a joke that day on my shirt, I wrote, I never understood the gait analysis patterns, and I walked up to Dr. Smith and I was like, do you like my shirt? And he got so mad at me. And that was before I told him I wanted to go into like acute care and everything, and I had to tell him, like, I'm kidding, like I just thought it would be funny, but he was really upset, and I just it
Even though it's not a silly story, I just thought it was so funny, and then it just shows how dedicated he is to acute care and everything acute care. So
I have with me fellow UIC alum, Lori Shelmerdine.
Yeah.
She's over in the West Coast. Where do you work at?
I work at St. Joseph Medical Center in Bellingham, Washington.
So shout out to the people over there.
Yep.
And how are you enjoying CSM so far?
I mean, CSM is always great. It's been really great this year. I really like the shortened sessions this year. Yeah, the hour and a half versus the 2 hours. It really has increased the ability to do more networking, more downtime, so that we have more energy to be at the meeting tonight, to be at the social tonight. I have more energy to stay. I haven't been able to do that before because I've just been so tired. So, and I really feel like it's allowing the presenters to really challenge themselves in getting their information into a smaller package, which I think is really good. Yeah.
Have there been any sessions that stuck out to you?
I went to the post-proning ARDS session, and that was I really liked that one because the pathophysiology of ARDS and proning is really complicated to me at least. And they went over that again, and they talked about, because verticalization is kind of new. I was, Kaylee Dayton and Heidi Engel are talking about that. And they talked about that in their morning session, and then it was really great to go then to another session that referred to that. And it's an area of practice that obviously I'm not doing, but that I'm going to be looking more into. So,
I have a memory of you from a couple CSMs ago. You were part of the Shark Tank.
I was just talking to Dr. Smith about that. So,
and it was so cool to actually see like this idea that you had in your head in terms of like early mobilization and in terms of gait training, and to see the amount of research that's just even since then. Was that 2 years ago or 1 year ago?
Oh my gosh, it was 2 years ago.
Yeah.
And there's been so much research that has really come up. Like some have been published in the Acute Care Journal. There's there was a couple of poster presentations in the cardiopulm section. So I'm interested to see what's there tomorrow in the acute care poster presentation. So
fantastic.
Yeah.
Is there anything that you've learned so far at CSM that's going to change your practice on Monday when you come back?
One of the first sessions I went to, I forget what the session was and who the speakers were, so I apologize. But they talked about, they had studied that the second session actually had a better predictive discharge destination than the first session for PT. And I think that's really interesting, so I'm going to go back and hopefully rewatch that session and kind of think about that more. And my colleague Dan Milner is here as well, and I think that's something we're going to really take back with us, because we're like, all right, we got the discharge recommendation and we're good in a sense, but thinking about that, okay, and as a clinician, I realized that first session is really just about getting to know the patient. They're so acutely sick, like they have a UTI, their antibiotics just started, but the next time I see them, they're much more themselves. And I think that is really, might really help us change our practice.
Absolutely. And that is so cool. There's evidence that's out there, and you're actually taking that evidence that you're learning on CSM and you're putting it into practice Monday morning.
Exactly.
That's fantastic. I mean, that's the beauty of CSM.
Yeah. All right. Thanks so much, Leo.
Thanks, Lori.
And go UIC.
I have with me one of our student leaders, Fred Guadalupe. Now, Fred, tell me, you tell the audience, tell everyone, all our listeners and watchers, you won an award today over at the APTA Acute Care meeting. Can you tell us a little bit about that award?
I did. Apparently, I'm just someone who doesn't know how to say no to a call to action. Or
so was that the Voluntold Award? So whatever you're told is that?
I guess so. No, I get every opportunity that I come across is a chance to do really good for the profession. And I, as an older student, I don't take those things lightly, and I don't know if it's making up for lost time or just wanting to have an impact. But any the worst thing that can happen is they say no, or you apply for a lot of things and they say yes to all of them, and then you're stuck doing everything. So
and it was a service-related award, right? In terms of all the volunteer service that you've done for APTA Acute Care, specifically for students, right, and the students that are out there.
Yeah, since I've come back to academia, in my 30s, going on this educational journey, I've always enjoyed helping my fellow students and just bringing whatever I can to make things better for them or make things easier for them. So and I think that's what PT and especially acute care PT is all about, is lifting the people around you. And I'm really blessed to be around people that see something in me that I don't always see in myself. So I'm just, really happy to be part of this community.
Fantastic. Do you have any shout outs to some of the other student leadership members, like for example Kelly and Megan and
Yeah, Kelly and Megan are like, just like trailblazers in my opinion. Like they're a little ahead of me in school. Also, Jema is like an amazing PTA. Like she's representing the PTA profession very well. The new cohort of student leaders is wonderful, and I'm really excited to see what they do in the future. And then we couldn't do it without our leaders, Lindsay Ardiff, Bridget Griffith, and Kim Lebenhagen and Abby McGowan have been such great mentors to us. So really, really happy to be part of that group.
Awesome. Well, Fred, congratulations, dude.
Thank you very much. I appreciate you. Thank you.
One last question.
Yeah.
Somebody told me that you are a big Star Wars fan. Is that true?
Yeah, it's so it's funny. I've been saying like I want, eventually at CSM I want this to be like that big Chewbacca belt and just drag on the floor, or I want someone behind me to like hold it up. So that's my goal, to have this really long. So
with all the hats that you wear and all the things that you've been volunteering for, I don't think that's not going to happen. Very likely you're going to get enough things to add on to your badge.
That's actually like the real reason I'm doing it all, right? It's just with all the ribbons and stuff.
For the Chewbacca badge,
of
baby.
course,
We got to make that happen.
Yeah. No, it's just this has been an amazing experience. My first CSM, and hopefully the first of many, many more.
I was sitting right next to Fred when they announced it, and so that was pretty cool. So again, congratulations that you got that award.
Yeah, they did a good job. I had no idea, and just I'm deeply honored.
I'd say Fred is the only one that had paparazzi that came up. When he got his award, he had a fan club come up and take pictures. Part of that fan club was Jim Smith and also Lauren, also one of our leaders. But still, he's the only one that had a fan club that took pictures.
It keeps happening. I don't know why. I don't know if I get the hype, but some people out there are getting the hype. So I appreciate them very much, and I couldn't do it without them.
Thank you, Fred.
Thank you.
Okay, I have with me some very, very influential people in my PT career. Jennifer Ryan and Sharon Gorman. And so the reason I wanted to bring the two of you here is that when I was a new grad, I came across an article in Jackpot, which was still the physical copy. And what was it called? Do You Own Your Practice? Was that the name of it?
That was my article. Ours was using the SBAR.
Using SBAR. Yes. And it was so instrumental. Was it 2013?
Yes.
Wow, okay. So what's crazy is that at the time I didn't know who you were. Right, I just knew that there was such a fantastic article. I was working in acute care. Fast forward, Jen becomes my mentor in terms of getting my CCS. And then Sharon, the first time I met you was Bridge the Gap in the very first one was at University of Indiana.
Yes.
And then later on, I went back to the article because my students at University of Illinois, I had them read that article because that SBAR was so important for me to be able to use, and it was so useful on the acute care floors. And then when I put two and two together, I'm like, oh my gosh, Sharon Gorman, Jennifer Ryan, these are like my friends, and this article actually made me the PT I am. So I just want to say thank you so much.
Now I feel like I'm going to cry.
And I will say the other thing too is that I was on the panel for the Oxford debate last year. This is my second year, and what was just so cool is when I look across and I see Aaron Thomas, Lisa Curry, Sharon Gorman, Adel Mazinski. It's just these are like my heroes. So to be able to be up there with you all is such a privilege. So I just want to say thank you for all that you've done for me in my career, because I'm the PT that I am now because of you. Thank you so much.
I'm stealing your microphone because I want to say thank you as like the future of PT for just like stepping up, being a leader, being a mentor, being a person who's like taking a role and being active, because I can't say enough about like you're a force. I'm getting old. The hair is gray for real. It's not dyed. And it's great to see the future of PT and the future of acute care, and it gives me a lot of hope and a lot of happiness. It's going to be nurtured. It's going to be cultivated. It's going to be supported.
And I'm excited that people like you are stepping up to be our leaders of the future.
We would like to thank all of the APTA Acute Care members and students who joined us on the podcast during CSM 2026. Acute Conversations is the official podcast of APTA Acute Care. This episode was hosted by Leo Arguelles. Executive produced by Katie Brito and Edward Mathis, with music by Alexia Action from Pixabay and sound effects also from Pixabay. For more information about APTA Acute Care, be sure to check out our show notes for links and resources from the Academy. If you found value in our podcast, please be sure to subscribe, follow, and share it with your friends and colleagues. Join us next time for another engaging acute care conversation. Thank you for listening, and may your shoes and scrubs stay clean today.
I'm sorry, I lost my train of thought.
It's
We
okay.
do that again.
Not a problem. Not a problem. We did this last year.
Here we go.
Okay, here we go.
This is only glass number 1.
All right, let me take it.
We're already messing it up.
It's okay. That's all right. The
We need a sip.
power of editing and AI. We can make this sound perfect.
Am I about to be unhinged about Barb?
This is
Are
going
people
to be
gonna video me
fantastic.
talking about?
No, you are being video recorded as we speak right now. So okay, let me make sure
Team
that
Barb.
Team Barb, we got recording, we got audio.